So let's talk about some terms to repair fractures. Reduction is placing the dislocation or fracture fragments back into adequate alignment. Fixation is using any kind of device to hold the fragments together. So maybe you've heard of ORIF, open reduction internal fixation. Open means there's a surgical incision involved. Reduction means alignment, realignment. Internal means inside of the skin, and fixation means to hold together using devices. So an ORIF, an open reduction internal fixation, is a surgical procedure using internal devices like screws and plates to hold the bone fragments in alignment. So here is an x-ray of an ORIF, an open reduction internal fixation of the ankle. And I wanted you to notice that when you look at x-rays of an ORIF, especially when screws are involved, that those screws will point in different directions, because if you make all the screws line up with each other and look good on x-ray, all those screws running through the same plane risk fracturing the bone again. And so that's why when you see screws placed in an ORIF, you will see the screws all pointing in different random directions, and so that's so that they do not create a new fracture from being all in alignment with each other. So closed reduction, closed means there was no incision involved, and reduction, again, is realignment of the bone fragments. In this case, with a shoulder dislocation, this person is undergoing a closed reduction, meaning there's no surgery involved. We're doing the reduction manually. These procedures can be very painful, and this person is going to require sedation and pain control. So external fixation means external, outside of the skin. Fixation, a device used to hold bone fragments together. So here is an external fixation device to hold parts of the wrist together. These pins go through the skin and insert into the bones and then are placed in this device to hold the bones in alignment. And what's important is the wound care around these pins. Make sure that there's good local care to prevent infection. Here's an external fixation device being used on the leg. Here is an external fixation device designed for the foot and ankle. Here is an x-ray of an external fixation device, and this external fixation device is being used to lengthen someone's leg. If we look carefully at the x-ray, we can see this fracture has been displaced by 2 inches, and they've done that on purpose so that they can add length to the leg. And here is a picture of a cast, and most of you know what a cast is. We can either use plaster or fiberglass surrounding some nice padding to hold bone fragments into place. Sometimes a cast is not adequate for adequate bone alignment, and that's why we would use an external fixation device. But what I did want you to see is how important it is for these extremities to be able to go outside of the cast so we can evaluate whether the fingers are getting blood supply and nervous supply. Here's someone in a body cast, and again, the toes extend from the cast so we can evaluate their neurovascular integrity. And there are all sorts of splints that are temporary devices that we can use to hold fractures in alignment. Here's a splint of the leg. Buck's traction is pull exerted on the lower extremity with a system of ropes, weights, and pulleys. This may be used unilaterally or bilaterally. It's used to immobilize, position, and align the lower extremity in the treatment of contractures, and especially in fractures of the hip and knee. So you'll see somebody in Buck's traction after a hip fracture. Maybe they're in their preoperative period waiting to go to surgery, and we'll put Buck's traction on that lower extremity to hold it in alignment. I think there's a board question floating around out there as to what to do with the weights when you're transporting the patient. And it's important that the weights always are in place and hanging to put pull and traction on that lower extremity. The weights may swing around a little bit, but because of the pulley system, a near constant amount of pull is being exerted on the lower extremity. And here's a Buck's traction system. Here they're using water as the weight, and since water has an exact amount of water, has an exact amount of weight, this system allows them to apply an exact amount of weight or pull on the lower extremity, and the water is easy to acquire and get rid of, unlike old lead weights, which are difficult to carry around. And there's all sorts of complex Buck's traction systems, and they get names like Thomas traction or Bryant traction. Where I came from, these were all just very complicated forms of Buck's traction. I wanted to talk a little bit about compartment syndrome. The extremities are divided into compartments. Each is surrounded by a fibrous sheath that has a fixed volume. And so here's an anatomical drawing showing slices through the legs. And I'm going to draw your attention to these neurovascular structures. They call them neurovascular structures because the major nerves and the major arteries tend to run together in the extremities. And the arm has compartments with major neurovascular structures running through them as well. And so here we've outlined a compartment that contains neurovascular structures, arteries, veins, and nerves. And so when a swelling occurs inside of that compartment, inside of that fixed space, either due to edema or bleeding, hemorrhage, which can be caused by trauma or surgery or burns, this can compress the structures within the compartment, compressing veins, compressing arteries, compressing nerves. So compartment syndrome is the compression of nerves and blood vessels and muscle inside of that closed space or the compartment that's within an extremity. And this leads to tissue death due to lack of blood supply, lack of oxygenation, lack of perfusion, because the blood vessels are being compressed by that raised pressure within the compartment. And so we have to do fasciotomy to decompress that compartment. So fasciotomy must be performed to allow the compartment to swell and release pressure that's against the arteries, veins, and nerves. So here we have a drawing of someone undergoing a fasciotomy due to compartment syndrome. And you'll see this with burns and other severe conditions that cause compartment syndrome when that area is compressing on nerves and arteries. The only way to prevent tissue death is to open those fascia through fasciotomy to allow the pressure to be released. So with any kind of vascular compromise, neurovascular compromise, you want to think about the 5 P's. Pain, paresthesia, which is a tingling sensation, pallor, which is poor color, pulseless, and paralysis or paresis. Paresis is just weakness. So pain, paresthesia, pallor, pulselessness, and paralysis or weakness is an indication of some kind of vascular compromise or neurovascular compromise. So it's very important after anyone's had a surgery on their extremity, anytime they've had a cast placed on their extremity, anytime you're evaluating a fracture in an extremity, it's always important to make sure that they are neurovascularly intact distal to the injury, whether it's a fracture, whether it's a surgery, whether it's a cast, whether it's a burn. It's very important to make sure that the fingertips and the toes are able to move, to make sure they have good capillary refill, and to make sure that they have normal sensation, indicating circulation, motion, and sensation. So you might hear this called neurovascular intact distal to injury. You might see this as CMS, or circulation, motion, and sensation, because that could mean the difference between life and limb.